to actually summarize then, what would I say has been very difficult to be living and working in schools as a school teacher? And I would definitely say that the hardest thing has been to have a health authority where we actually can't rely on what they're saying, where we feel that they are not protecting children at their place of work. What could they do? I mean, what could the health authority do differently? And what could the politicians force the health authority do to make schools safer and to make children's lives safer? Because this is the most important thing to me. It's how do we ensure that children are safe at their place of work, that we do not do a lot of speculating, that we actually accept that children are getting sick at their place of work, and what can we do about it? Well, there's actually a lot of things we can do. First of all, we could accept that masks, they're not perfect, but they do reduce the risk of infection anywhere from 10 to 50% with a normal surgical mask. If you then have an FFP2 mask or an FFP3 mask, you can get that protection level up to 80, 90%. So one, masking in school, masking the teachers, especially because we have to talk quite loudly. And as we talk loudly so that the children at the back of the classroom could hear us, that we're going to be spreading aerosols. So masks on the teachers, masks on the pupils. What else could we be doing to prevent? Because this is just one of the, if we go back to the Swiss cheese model, this is just one thing that's going to help. What we should be doing besides masking is actually screening children. We do know that both teachers and children can spread asymptotically. If we screen everybody once a day or twice a week, Monday and Wednesday, early symptoms or asymptotic, we'll find out which ones have COVID, isolate them. We could do classroom isolating, that the kids do digital learning for 2 weeks. Remember, every child in Sweden has a digital computer from the age of 10 that is provided by the school. If they need internet, they can get that from the school. So definitely masking, yes, remote learning, if we do screening and we find cases in the classroom. HEPA filters. HEPA filters have been shown to remove the virus from the air. COVID is airborne. How do we know we've got a lot of COVID virus in the classroom? Well, we could test the ventilation by having carbon dioxide meters. So we've got masks, we've got screening, preventative measures, we've got HEPA filters so that we can get rid of any virus that are in the classroom. So if we have parts per million level of around 2,000 parts per million of carbon dioxide in the air without it being filtered in a classroom, then about 4.5% of every breath that I'm taking is actually somebody else's exhaled air. And if they have coronavirus, then 4.5% of every breath I'm taking in can be infected with coronavirus particles. If we're in that classroom for a whole hour and we're a number of people, that could be an awful lot of people infected with coronavirus, because COVID is airborne and we know it's not just spreading within 1 or 2 meters of that child, it's spreading in the whole classroom. And this is a major problem. So, and of course, trying to keep the same distance. Why should a child have 10 square meters of space in a shopping center and 1 square meter in the classroom? That's just totally illogical. We should be doing much more to make it safe for our children to be in school and not be subjected to COVID. We don't know the long-term effects of COVID. What we do know is that the IQ seems to be affected, up to 7 points reduction in IQ, which will have enormous connotations for Swedish industry in the future. We need our brightest stars to build a society here. We also know that there's diabetes is actually increasing amongst those that have had COVID, and other long-term health effects that we don't know what they're going to be yet. So we really have to be working hard on protecting and keeping our children safe. And this is what I would like to see them doing. So masking, definitely. Weekly screening, preferably 2-3 times a week, every child. Carbon dioxide meters, every classroom, easily for the teacher to be able to see the levels, and open windows get in fresh air when necessary. HEPA filters, yeah. Well, we should have bought as many as we could over the summer. We should have installed them. We should have been ready for what was coming on. I was contacting the politicians, Skolverket and the Folkhälsomyndigheten, asking them, begging them to actually have a strategy of installing HEPA filters. This will not be our last pandemic. The debate about school safety has been absolutely massive in the US. They promised to put 2 HEPA filters or 2 filter units to remove viruses from the classroom by the end of 2022. So they had a year. The New York State has already installed and bought 100,000 HEPA filters. They are key marked for schools. The unions in America have been very strong, ensuring that we do our best and our utmost to keep not only the teachers safe, but especially our pupils. We do know that most children get mild COVID, but many do not. A number get long COVID and many get very sick. So they've been very active. The US has been doing a great job of installing HEPA filters. We need to make sure that our schools are safe, both from COVID and COVID mutations in the future, but also from future pandemics. Remember that if we start to install virus filters now, we're actually creating a safer environment for our children in the future, not just saving them now. We have to consider all the different variants that we are going to be getting as we carry on. One thing we can be sure of, the more that we allow the coronavirus to spread, the more it is going to mutate. The more it is going to mutate, the ones that are going to be dominant are, of course, the ones that are better at spreading, potentially that our vaccinations are unable to work as effectively. So when you get a big spread in a country, you're going to be risking getting a larger mutation. So what I just hope that we're able to do is make schools safer. I want schools to be safer in Sweden, and I'd really like to see schools being safer around the world. That's why we're continuing to try and get our message across here. I wanted to make sure and clear that you understood what's going on in Swedish schools, because our Prime Minister has actually mentioned that Sweden is doing the same as most other industrial nations. And I don't feel that they are. I feel that in schools, in any case, we're doing almost nothing to protect Swedish children. And that's what's worrying me. I hope that your children are much better protected in your countries. And I think it's together we need to continue and try and do our best to ensure that children around the world in school, where they don't have a choice to go, they have to be there. So we need to ensure that schools are a safe place for our kids to be. And let's work together and continue to fight the good fight for the sake of our children. Because remember, they are our future. They're everybody's future. And if children aren't priority number one, then who is? Children should always be priority number one. Their safety comes first. Thanks very much for listening. And I'd love to hear what your thoughts are in your countries. Take care. Bye.